This is the news at 6.
There is a new report shining light on the mental health crisis plaguing Idaho's youth. The wait list for mental health care providers is growing, and rural communities struggling to access support. Now, experts say the state system needs a major overhaul. Jude Binkley joins us with a look at what this report lays out in terms of change. Jude?
Well, Hunter, experts say the current landscape in the state is making it difficult for kids to get the care they need. Now, using information gathered through interviews with leaders across the state, this report recommends 5 major things to help our younger population. The Gem State is struggling with a youth mental health crisis.
Navigating services for a kid is so challenging. Wait times, finding the right fit, finding somebody that takes your insurance, it's hard.
A report was commissioned by the Blue Cross of Idaho Foundation for Health after they heard communities across the state voice concerns about behavioral health for young people.
Youth behavioral health is everyone's responsibility, and we wanted to make sure that we are adapting and supporting the communities where they are.
The findings paint a clear picture. 5 critical roadblocks standing between Idaho kids and the help they need. The study recommends a prescription for change that includes increasing reimbursement rates for Medicaid, decreasing the burden of paperwork, bolstering mental health care in Idaho's rural communities where resources aren't as abundant, and increasing funding for schools to implement evidence-based resources.
We see an opportunity to really reinforce the services and supports within schools. Schools are often really seeing mental health issues when they first manifest. They're the ones to catch it, and sometimes they have to be the end-all be-all of the mental health system because there's not resources within the community.
Report author Rachel Blanton says the study also recommends creating a state interagency work group to better coordinate how to address the state's mental health crisis.
When we set up the systems in the way that we have in Idaho, we're not doing the best that we can for them. So there's opportunities to better change our systems to deliver care.
If these are all the hoops that you have to go through to get your kids into services, that's huge.
We were really excited to see all of the entities that did attend today. That tells me how much the behavioral health crisis in our state is resonating, and that the need that many of us are concerned about and how we can come together and have a better understanding.
While school and healthcare leaders map out solutions, Blanton says there are steps every family can take today to support their own children.
There are opportunities and there are services for your kids. Sometimes you have to search for them, and you have to find those leaders within your community right now that really know how to navigate. So I think about creating those community connections and figuring out who that point person is in your community. There are options for your kids. They're really hard to find. We understand that, and we hope that part of this report will really drive some of that change.
And we'll have this full report linked in our web story at ktvb.com. Hunter?
Yeah, when it comes to mental health, community is a huge help. Thank you, Jude.